Hi guys, this is Oski Witobi. Today we are going to talk about evaluation. So evaluation SBAR is basically handing over to either a nurse sheet or to a doctor or to a community nurse. Okay, so today we are going to focus on end of life. Alright, so I have a scenario here. I'm going to read it out for all of us to learn from it. Okay, so basically to be able to understand what the evaluation SBAR is, this is what I was taught. So during the exam or when you are practicing, arrange the sheets according to in order or in ascending order. So assessment will go first, followed by planning, implementation, then your evaluation sheet. Okay, so you have your assessment plus your news two charts you did, then your planning, then your implementation, the drugs you administered. Okay, then your evaluation. So that I'm going to go over or give you a scenario, then we'll look at the steps or what the SBAR is. Okay, so you're supposed to use a blue pen for this procedure. So you'll be given a blue pen by your examiner. Okay, so this patient is called Pat. Is an inpatient in the oncology ward under your care with progressing stage 3 colon cancer. 3 years ago, she was diagnosed with lungs and liver metastasis. Pat had a cholecystectomy 2 years ago. DNR is signed, that is, do not resuscitate or do not resuscitate or allow a natural death has been signed. Patient is constipated. Please hand over to the next shift. So this is the patient's most recent observation. Temperature at 37.1 degrees Celsius. Pulse is 76. Respiration is 21. Oxygen saturation is 99. Then blood pressure is 145/63. So the patient is at a new score of 2. Alright. So using the situation background assessment and recommendation 2, please make notes regarding your patient and use this to verbally hand information over to the next or 9 shifts. That is the examiner. This is a verbally assessed station. You have the opportunity to make notes to support your answer. So this is an 8-minute station. Okay, so the time is 1400 days today. So you'll be given a sheet like this to make your notes. Alright, so we have the sheet here. They've given you a guideline, situation, background, assessment, and recommendation. Patient details will be in here. Okay, so the evaluation. So we have the S. So that's the situation. So what are you supposed to do there? What thoughts should come in mind when you are that part? That's the S bar. The first one is situation. So you're supposed to introduce what yourself and a clinical setting. So if it's you're handing over to the next shift. So hello, this is Winifred. This is the oncology ward. This is the AMU. This is the ICU. Okay. Then you need to state the patient name. So this is Pat Lawson. So I'm going to use. So this is Pat Lawson. Hospital number is 004321. Patient date of birth is 1/1/1948, and the location of the ward is head and neck unit or ICU or ITU. Okay, then why are you handing over? So the first one, introduce yourself in the clinical setting, then you come in with the patient background details, the name, hospital number, the date of birth, and the location of where the patient is. Then the reason why you're handing over to continue with the care. So since I'm done with my shift, alright, I'm going to hand over to you so you continue with the care for this particular patient. Then we'll move on to the background. What are you going to do there? You need to state the days the patient was admitted or the reason for admission. Okay, then the diagnosis. So this patient was admitted on the 1st of July 2024 with colon cancer, progressing stage 3 colon cancer, and she's experiencing abdominal pain and constipation. She also had a pain score of 8/10, and she had a news of 2. Okay, and so this patient is diagnosed of stage 3 colon cancer. Okay, then you go on to the patient's previous medical history, allergy, relevant medication, or social history. So this patient has a medical history of cholecystectomy, which she did that 2 years ago. She also has lung and liver metastasis. Patient has no known drug allergy. Patient takes medications. Alright. Leukemia or lung and liver metastasis medications. Okay, then the social patient lives with a husband and has 2 children. They live in a bungalow, which is a story building, and there's the husband that basically goes to town to get item. She doesn't smoke, she doesn't take alcohol. Then you now go on to give details of the current events and the details of the assessment. So the news 2 assessment you did for the patient during the A to E, you compare that to the evaluation, the current evaluation that has been given to you, that's the news 2 that has been given to you here. Okay, so this is how you go about it. And so previously my patient had a total news score of 5 because the respiration was around, she had a respiration of 28, SpO2, because she had a SpO2 scale of 86, which is very low, and blood pressure of 180, 95, pulse was 100, and consciousness was alert, and temperature was 38.6. And so basically she had a total score of 5. So this is what we did for her. We monitored her. Okay, so she had a total score of 7. Okay, a total score of 7, which is very an emergent response. And so we continually monitored her vital signs, and we also informed the registered nurse who called the medical team to review this patient. So we had a lot of specialists coming in, and his 2 team to have a look. Critical care nurses coming around to have a look at this patient. And so this patient is being here now. So when you compare it to the current news 2, there's been a great change. So he's now at a news score of 2, which is very good. And so now his temperature is now 37.1. Previously he had 38.0, which was high. And the pulse is 76. It's within a normal range. And first he had 90. The respiration has reduced now. It used to be 28 and it's now 21, which is good. Oxygen saturation is 99%. Previously it was 86. And then blood pressure has also reduced drastically. It's now 145, 63 millimeter per mercury. Previously it was 186, 65, which was high. And now the total patient is having a total score of news 2 of 2, which I see to be a great change, and this patient has really improved. Okay, so this will basically be the first point for the assessment. Then go on to the main needs of the patient. That will be the planning. So we don't go on to the planning, and this is what you say. So we identified 2 main nursing needs for this patient. The first one was that this patient has abdominal pain. Okay, so what we did for her is that we are going to manage the pain through pharmacological and non-pharmacological measures. So we are going to manage the pain through pharmacological and non-pharmacological measures, and all nursing interventions were done. So we gave her pain relief and monitored her for 30 minutes, and 1 hour later the condition of the pain subsided. We also referred her to the pain team, which really helped. They encouraged her to do deep breathing exercise, which also helped. And then the second problem was constipation, and so the aim of care was to use pharmacological and non-pharmacological measures to help relieve the patients of this constipation. Because of a condition, this it's normal that he or she is going to have constipation, because she has a stage 3 colon cancer. Okay, so we re-evaluated that this patient's constipation is going to be relieved, okay, weekly, all right, and weekly. And so the next interventions we did was to administer prescribed laxatives, encourage her not to prevent the acidificate, taking a lot of fluids and fruits and vegetables, which has also helped to free his or her bowel. So that is the plan. And for the implementation, so this were the medications she was taking. So all medications served, or you can say all medications served. If you have time, you can just mention that the medications you served. So she was on these drugs were served. So we said paracetamol because of her pain, Senna because she was constipated, oxycodone because of her pain of 8/10, and metoclopramide because he felt nauseous and felt like vomiting. And all these medications were served, administered, and charted. You can just say that and move on. Then, is there any other areas of concern? So this patient has signed a DNA out, so you need to mention it. And this patient has been having dyspnea and difficulty breathing, because you remember that the oxygen saturation was 89%, so you need to mention it to the next sheet. Okay, so this patient has signed allow a natural death, which is being placed in the medical notes. Make sure you have a look and follow that. And this patient has been sometimes complaining of dyspnea, so kindly take note of that and be monitoring the oxygen saturation. Is that okay? Okay, so yeah, so this is basically what a Lawson condition is. So this is a situation. I mentioned the situation, the background, the assessment, and recommendation. Okay, so when you're done, you just tell the examiner, I want to end my station, and that is it. Thank you very much for listening. Bye.